Well, hello, everybody, and welcome back to episode 26 of CCA's, we're going to call it video podcast series now. There's been some confusion. There's been some controversy about whether we're podcast or we're a video series. So if we're a video podcast, a video series, because we do a bunch of these different things. So it's all good.
Didn't even know there was a difference.
No, it's come up a couple times lately, I will tell you. Like, people are like, well, Nate walks today. He's like, I didn't know it was going to be on video. So we need to probably start making that more clear.
Are podcasts typically live in nature?
I mean, podcasts aren't typically as good as ours. I mean, so it's like our production values are so much better. But so we have like about 428, I think, podcast subscribers as of this morning. And so last week was episode 25. Now we've passed our silver jubilee. We're on our way to 50. We better have 500 subscribers by the time we hit 50 episodes, or I won't be sitting here anymore. We'll have to have turned it over to somebody else. So, what's that? That's true. So today we're here with a really good friend of not only myself but our organization. So today it's April's Testicular Cancer Awareness Month, and I'm gonna make sure I don't make any comments because I'm a prostate cancer guy, so I know about the jokes, but anyway, I'm going to say I'm not going to make jokes, and then but you'll know I'm making a joke by saying it. So that'll take care of that.
I am appreciating your attempt to be appropriate.
Okay, there we go. So anyway, we've got Nate Krugman here with us today. He's a good friend of mine, and like so many other testicular cancer survivors, was diagnosed very, very young with that. So we'll talk about that today. I've got Jill, my colleague, oncology nurse practitioner, 20 plus years experience, and has a unique connection to this in that her son Jeffrey is also a prostate cancer survivor. So Nate, welcome.
Thank you. Good to be here.
Good to have you here. So we got a lot to cover today. And so one of the things I wanted to make sure that we talk about is and this is kind of a side note, but you're with Leukemia and Lymphoma Society now too. And so we see a lot of blood cancer patients in here, and I want to make sure that people know that we do have a connection with you guys, and it's a great resource for people that are dealing with blood cancers. You guys do amazing work, so we'll have you on a future episode just to talk about LLS as opposed to testicular cancer awareness. But anyway, Nate, can you kind of take us through, I know you and I have talked before, but if you can kind of take us through kind of your journey, kind of when you were diagnosed, how old you were, how you knew you had a problem, and just whatever you want to say, basically.
Yeah, Steve, it's I was thinking about it this morning, and it's been a while since I've kind of talked about it, but I went to Miami University and never was sick, didn't know my doctor's name, never went for checkups, just never really went to the doctor. And I remember I was just graduated from Miami, bought a new car, and was living with a friend out in Anderson. Okay. And
that's a big commute, from Oxford to Anderson.
Well, so this was post Miami.
Gotcha.
So I had started actually working at the Newport Aquarium.
Okay.
Kind of a dream job at the time, and I just remember this kind of a dull pain.
Okay.
And it kind of come and go, and I just remember in the shower and just kind of felt it for the first time, and I just remember laying in bed, and I just am very optimistic.
Yeah.
But I just had this weird feeling. I was like, I just don't think this is good. And so played baseball. One of the guys I played baseball with, I said, hey, man, I've got this lump on my testicle. And he said, nah, don't worry about it. It's just a cyst. And so I said, oh, man, Paul, I think I've got to go get this thing checked. And so, again, brand new car. And I remember going to my family phisian, who I don't think I've ever met before. And I was nervous.
That's a fun thing to go in and talk about on the first visit.
Exactly. Really get to know me on the first visit. But I remember I had this brand new car, and sky's the limit, just excited about my future. And I remember pulling in, and they had one of these big rocks, like with the address on it.
Oh, yeah.
And I cut the corner because I'm nervous.
Oh, no.
And I drilled my bumper, and so my bumper's hanging off, and I like pull into this spot, and that was kind of like the way the day went.
Okay.
So I remember pulling in and met the doctor, and he just kind of took a flashlight. I mean, this is kind of weird. I don't know if this, Jill, you have to tell me, but took a flashlight, and he could tell that it wasn't good.
Okay.
And looking at the
Tell
lump,
if it was solid
yeah,
and not fluid filled.
Yeah.
yeah. So he went down the hall, and I remember hearing him on the phone. He's like, "Hey, it doesn't look good. I'm gonna send him your way." And I'm like, "Hey, Doc, I can hear you." And so, yeah, kind of blurry, but I just remember getting into my busted car, my busted new car, feeling that way. And I remember going to the urologist, and I'm not going to make myself look very smart, but I remember pulling in, and I didn't know what a urologist was. I mean, I was 24 to answer one of your questions. 24, and I'm like, what does a urologist do? So I'm out in the lobby, and I'm reading a sports magazine, Love Sports. And I was so nervous. I was pretending like I was reading, but it was upside down. And then they called my name, and I remember going into Dr. Keys. And I remember going in his office, and kind of sorry, Dr. Keys, but disheveled desk.
Okay.
The blinds were down, and then I'm starting to put all of it together. Like, I know what a urologist is.
Okay.
And then I was really scared.
Yeah.
I was really terrified. And then fast forward, he was like, yeah, it doesn't look good. I think he said it most likely is cancer. They didn't know until they removed it. But yeah, it just all started there, and then it was just like warp speed ahead.
Mm-hmm. So other than wrecking your new car, having a complete stranger mess around down there, and finding out you had cancer, it was a good day.
It was a hard, it was a good, hard day.
Good.
Lots of things changed that day. Lots of things.
All right. So Jill, why don't you take us through, if you could? So, because what's really important that Nate mentioned, which we've heard before, and I think this is really important for young guys to know this too. He mentioned like adult pain. So, why don't you kind of take people through what should they look out for? What might just be, because you hear, oh, I've been riding a bike or whatever. But like, what is the pain that you need to worry about? Well,
and for anybody because like we talked about, testicular cancer tends to hit a younger population, and it's not common to have pain in your testicles. Okay. Even for, don't get me wrong, you're right. Like if you're an avid cyclist, but if you're an avid cyclist, most of the time you get the pain kind of early on, and then your muscles kind of adapt to, and then most avid cyclists get special seats, and there's all these things that they do to accommodate that. But it's not normal to have any pain in the testicles at all.
Unless if there's like a screaming one hopper. Feel at third base.
Yeah, I have 3 small kids, so I've learned to teaching them how to swing a bat.
Yes. And then the other thing is any change, any increase in size of the testicles, any change in like the firmness. I remember when Jeffrey got diagnosed. When your mom's been a nurse your entire life, and then you know that she's a nurse practitioner, there were very few things that he didn't tell me. And on occasion, I would have to remind him that I was his mother, and there are just certain things you don't need to share. But he called me, and he was like, and he had just gotten out of the shower, and he was like, Mom, something's wrong with my balls. And I'm like, thank you very much.
I thought we weren't going to use those kinds of terms. Now, you just opened up the door.
I know, I opened up the door. However, let's keep it real. And I remember saying, okay. And I'm thinking, God, this could go in so many different directions. And I said, well, honey, what do you mean? He says, well, one's kind of sore, and one doesn't feel like the other one. And I said, well, they should be kind of firm, kind of like a grape, so what are you feeling? He says, one feels like a grape. I got another one that feels like a marble, like it's hard like a marble. So we started talking at that point about what some of the common things in young men that can cause that. And, but nonetheless, we went through kind of the series of troubleshooting that. And when it was very obvious that it wasn't infection related and there were no other causes, he had an ultrasound. Okay. And the ultrasound was kind of the definitive. It showed absolutely without a doubt that there was a mass that needed to come out. So the difficult part of this is that, and we've talked about this in regards to other diagnoses that hit predominantly men. men like to ignore things. And when you're dealing with young men and parts of the body that they don't necessarily want to talk to somebody else about, it really can go longer than what it should. And we'll talk about this a little later, like the survival rates in early stage testicular cancer is super high. So making sure that you're aware if you notice any pain, if you notice any changes in one side versus the other, any swelling that's out of the ordinary, getting in to be seen soon, because sooner is so much better than later.
Yep. Well, like you said, and that's the good news, that caught early, it's almost always curable. That's the good news.
Yes.
And so I was even surprised too, even when I saw that, I was surprised that even the cure rates were pretty good, even when it metastasizes. But can you talk briefly about, we're gonna do a second episode. You go with that?
Yes.
Okay, all right, because we're already starting to run low on time. But when it does metastasize, and this is why you don't want to let it go, we found out some things yesterday that surprised us about where it metastasizes to. Can you talk about that a little bit?
So most common site of metastasis with testicular cancer are the regional lymph nodes there in the pelvis. So, and not to use fancy, but regional is right there, right around the testicles, right in that area. However, the most common cause of spread outside of the pelvis is the lungs and the lymph nodes around the lungs. And then if it goes on even further than that, it can spread to the liver and to the bones. So definitely don't want to let it continue to go untreated.
Yeah. And then so what are the typical, in treating testicular cancer, what are the typical modalities that are used to treat that or to cure it?
So most common, once it's spread outside, surgery is always number one. And then if it's moved outside of the testicle into the lymph nodes, or depending on the size of the mass itself, then they start talking about the use of chemotherapy. So kind of your typical things that you would expect with cancer.
Okay, so now I think what we'll do is, especially since I just pressed you into service for another episode, is we'll come back, and what I want to talk to you about, Nate, is kind of what your treatment was, just to be a little bit more personal about how difficult that part of the journey was. And I really want to talk about some of the things you did after that. Just in terms of bringing awareness, because you've got a really, really cool story. So we'll talk about that on next episode. So I think we'll go ahead and wrap up for today. Thanks, Nate, for coming out. And
thanks for having me.
Yeah. And so we'll be back with another episode next Wednesday, and we're going to have a second episode next Thursday. Why are we going to do that?
Because we've got other episodes scheduled.
All right. Okay, gotcha. So
Thursday at noon.
Okay. All right. Well, there you go.
Wednesday and Thursday next week at noon. It'll be a twofer.
A twofer.
Week.
Twofer. All right. Thanks, everybody. We'll see you soon.